And now to help us make sense of these record-breaking numbers, we have with us Guido David of the UP OCTA Research. He is joining us live via StreamYard. Sir, thank you again for joining us and welcome back.
Yes, hi, good evening, Ed and Gretchen.
Yes, sir. Well sir, 7,100 coming from what? 4 to 5,000 in the past few days. Are we looking at a new trend or is this a one-off?
Well, it's the same trend pa rin from the one we were seeing. Of course, nag-increasing trend compared to what we thought was the trend ng beginning of March, and that's why napaaga yung projections. We're seeing it earlier than we thought we should, pero this is we're still seeing around 10 to 11,000 cases per day in the Philippines by end of March. Based on that current trend, it's based on the reproduction number of around 1.9, which is what we are seeing right now, 1.9 to 2.
So, sir, let me go back a bit. You're saying you are now seeing, if the trend continues, 10 to 11,000 new cases per day by the end of March. Did I hear you correctly? Because previously, I think it was sometime last week, we were still looking at 8,000 per day by the end of March.
Yes, now we're looking at around 10 to 11,000. I mean, syempre, as always, we hope we are wrong sa projections, or we hope na we beat the projections in the sense na we can lower the numbers, and that's why we're always calling for people to support yung wear face mask and follow yung health guidelines, because we don't want to reach these numbers. These are very bad numbers. This is a nightmare for us. We have the highest number of cases now, and it's not the end. This is not the end. It will still go higher than this. And I mean, ano nang gagawin natin?
Yes, sir. Well, I do remember last week you had projections as well for the middle of April. You were looking at possibly 18,000, but that was with a lower figure that you earlier had for the end of March. I'm wondering now if you have new computations for the middle of April.
Well, we haven't looked that far yet, Ed, because we haven't gotten the latest data from Department of Health. We're still waiting on it. And secondly, we're hoping na somehow yung localized lockdowns, curfew ordinances, city ordinances, and this new circuit breaker ng Malacanang, which will limit capacity in certain establishments. We hope those will have an effect on the numbers and the trend. We were starting to see a slight decrease na R, but I think because of today's number, tumaas ulit yung reproduction number. I haven't calculated it yet, pero we're gonna see. But we hope that the efforts of the local governments will help in reducing the reproduction number. Hindi pa tayo pupunta sa downward trend, but at least we can slow it down somehow.
Yes, sir. Well, certainly alarming numbers coming from Professor Guido David, 10 to 11,000 possibly by the end of the month. Thank you, sir. That was Professor Guido David of the OCTA Research Team.